In the recent weeks, I have observed a new trend where, along with the general purpose large language models, I am observing an influx of domain specific LLMs like the one you are seeing on your screen. Llama 3 Aloe 8 billion alpha is from the medical domain. Aloe is a new family of healthcare LLMs that is highly competitive with all previous open models of its range and reaches state of the art results at its size by using model merging and advanced prompting strategies. Aloe scores high in metrics measuring, ethics, and factuality thanks to a combined red teaming and alignment effort, as you can see in the screen. Complete training details, model merging configurations, and all training data, including synthetically generated data, will be shared on this Hugging Face model card, and I will be dropping the link of it in video's description. Also, the prompting repository used in this model to produce state-of-the-art results during inference will also be shared. Allow comes with a healthcare specific risk assessment to contribute to the safe use and deployment of such systems, as you can see on your screen. This model has been developed by HP AI and it is a casual decoder only transformer language model. For now, it only deals in English. And as you probably can sense from its name, this model is based on Meta Llama 3 8 billion and is governed by Meta Llama 3 license. In this video, we will be installing it locally on our Windows system and then we will be testing it out on few of the medical benchmarks questions. If you look at this benchmark information from the Hugging Face card, Allo has been tested on the most popular healthcare QA datasets with and without med prompting inference techniques. And you can see that the performance of Allo is quite competitive even against the bigger models, such as if you look at um, the model such as Meditron, Llama 370 billion, and then at the very last row you see that Allo's performance 76.88 is better than Meditron on average. It is better than G9B and it is better than a lot of other models including Mistral 7 billion and Medalpaca 7 billion. I would be, by the way, very keen to see its performance against OpenBio LLM, but I think that model is way better than this. But again, this is not a bad model at all. I think its memory requirements are even low. So if you're looking for a smallish medical LLM, give this model a try. Okay, in order to get installed this model on your local system, the tool which I'm going to use is LM Studio. If you don't know what LM Studio is, I already have covered it a lot on my channel. So simply search for LM Studio. And then once you have it installed, launch it on the home page. Simply type allow, press enter, and you will see there is a cont available. So I have downloaded my favorite cont, which is Q5KM already on my system. There you go. And this is a file. And now let's load it into our system. Let's wait for it to get loaded. Model is loaded and I have one GPU card of 16 GB VRAM and my memory is 32 GB. So you can see that it is right now occupying around 7 GB of RAM. Let's try to select the Llama 3 preset from the top right. And then let's also try to offload it to GPU. And let's reload the model. And once it is reloaded, we'll be ready to chat with it. That's done. Let's ask it few questions. By the way, before I test it out, one thing I wanted to make sure you are aware is that no large language model is substitute for the doctor. So if you have a real health condition, Please don't rely on the advice from large language models. This is just for educational and testing purposes, or maybe it is for the health physicians to augment their work. So, if you really need some medical advice and attention, please reach out to a human doctor, because these LLMs are not the replacement of the human doctors. Okay, that out of the way, let's try it out on some of the diagnostic benchmarks. I'm asking it, a 45-year-old male presents with chest pain and shortness of breath. What is the most likely diagnosis? Let's wait for it to print the response. That's done. Let's go up. Look at the response. And given that a patient in their 40s is experiencing chest pain and shortness of breath, there are several potential causes to consider. There's some heart attack, and also has given its medical terminology: angina and pulmonary embolism, and if you scroll down, pneumonia and few other. And it is saying that it is essential to note that these are just possible diagnoses based on given information. A healthcare professional would need to conduct a thorough evaluation. Very nice. And this is what I was telling you, that remember that AI models are not intended to replace professional medical evaluations. Amazing stuff. But all in all, it has very concisely and very compactly answered your question. Amazing stuff. Okay, let's try to ask it one more. I'm just going to ask it about another diagnostic question. Let me paste it there. Please bear with me. I'm just copying it. So I'm asking it, a 30-year-old female has a fever, headache, and stiff neck. What are the possible causes? Let's wait for it to print. And look at the model's response that given these symptoms, there are several potential causes: meningitis and then viral support. So its diagnosis is really good. I mean, I'm very impressed by it. Amazing stuff. And again, the warning about not intended to replace. Amazing. Okay, let's try out another one. Let's try out after diagnosis the treatment. What is the recommended treatment for a patient with type 2 diabetes and hypertension? Let's wait for it. So you see, it has very nicely given us some of the pointers around recommended treatment for patient with type 2 diabetes: lifestyle changes, blood glucose, blood pressure, and then cardiovascular risk assessment, regular monitoring, and all that stuff. Amazing. Let's check another one. Can you recommend a suitable antibiotic for a patient with penicillin allergy? Let's wait for it. And you can see that it has again produced a very fine response, that it has a documented penicillin allergy, then it is just going skin infection, respiratory tract infection, and so on and so forth. Amazing stuff. Let's ask it about a medical procedure. So I'm asking it, can you explain the procedure for a total knee replacement? There you go. So it has given us a total knee replacement. Don't try it out at home. And then not only it has given us a procedure, but also the total duration, rehabilitation, and all that stuff. So all in all, amazing model. As you can see, I will drop the link to its model card in video description. Let me know what do you think. If you like the content, please consider subscribing to the channel. If you're already subscribed, then please share it among your network as it helps. Thanks for watching.